Welcome to Arch Ghost, the show focused on creating high caliber, adaptable, and prosthetically driven full arch surgeons. The surgical techniques described and depicted in this podcast are provided by Arch Ghost LLC solely for informational and educational purposes and are intended exclusively for properly trained, licensed, and clinically competent healthcare practitioners acting within the scope of their professional credentials. As a licensed healthcare practitioner, you alone assume full responsibility for all clinical decisions, actions, and outcomes as part of your patient care. Please see our full legal disclaimer at archghost.com/disclaimer. So today we're going to talk about why arch count is not the same as experience. And I think this is an interesting topic because there's a lot of, talk and back and forth amongst surgeons, specifically those of us in the full arch full-time space about, your arch count and how many arches have you done. And I wanted to talk a little bit about, there's a lot of value in that and a lot of value. I mean, obviously the more you can do, the better, right? But I want to talk about what I feel truly makes up an experienced full arch surgeon. And it's not just arch count. And so I want to look at that and I want to talk about why. Now, arch count, an arch count is, when I say an arch count, it's just how many arches you've done. And this number is a good indicator of your progression in your experience to some extent because, more reps, more volume, more practice is obviously beneficial, right? The more you can do, the better. I'm never going to argue with that or say that you shouldn't do more. Keep in mind, as I always say, that you probably should cut in half whatever somebody tells you they've done. I feel like that's pretty, for whatever reason, it's pretty standard. But, that being said, I think the arch count is a good tool to kind of keep track of where you are and how your experience grows. It's best utilized if you keep an arch log where you actually keep track physically of every arch you've done so that you have an accurate number, not a wild guess, but more importantly, so that you can put notes down about, why something failed or why something succeeded, something positive about a case that you want to remember. But being able to kind of keep that log and keep track of those arches as you get more and more and more and more and more experience, you're going to see trends. And if you work in like private practice and you work with, let's say, 5 referrals and you're tracking things and you see like one referral, you have almost no failures and the other you have, multiple failures. It's like, okay, what's being done on the restorative side there? So it allows you to have data, to track your arches. So very valuable to keep an arch count and an arch log. Now, that being said, an arch count is just one measure of true full arch experience. And when I think of true full arch experience, I think that, the equation really should look something like this. So if we're going to say true full arch experience, this is going to be equal to two things. All right. So the first is arches cut. Okay, this is basically your arch count. That's what arches cut is. But that's not the only contributor to your experience. True full arch experience is arches cut times time. Okay, and I think time is one of the most undervalued components of full arch experience. And I specifically put arches cut times time. I think it's a multiplicative effect, not just an additive effect. The reason that I think time is so important is that there has to be enough time that has passed from the date of your surgeries that you are able to see, the obvious thing is, at least 4 months to see your integration. But B, what do your cases look like at a year? What do they look like at 3 years, at 5 years, at 10 years? And myself, that this is an area that I am constantly um, assessing and trying to get improvement in, because I haven't been doing full arch surgery for a decade, so I don't know what my cases look like 10 years ago. I've only been doing it 7 years. Um, but sticking around for a longer period of time and being able to track your cases is incredibly valuable, because there is a lot of migration and movement within the full arch world of providers, and that is what it is. But I think there's a lack of understanding of the long term effects of your surgery and of just the full arch procedure in general. Um, one of the positives and negatives of all the full arch opportunity out there today is that there's a lot of opportunity for a lot of different providers to get a lot of experience very quick. And that's great. I mean, that's not a negative. The more you can do, the quicker you can do it, the better. However, I feel that many providers have developed an unrealistic or maybe unvalidated level of confidence because they've done a very high number of arches, let's say in a year. And the danger in that, overall, that's good. Again, do as many as you can. I'm not saying that, but the danger is you become very confident that what you're doing is working in the long run. And the reality is you don't know. Um, and being able to, again, look back on cases that have been done, 5, 6, 7, 8, 10, 15, 20 years ago, that really gives you the ultimate understanding of not only how your surgeries perform over time, but just what happens to a full arch patient over time, and what things can contribute negatively to cases or positively, and what things you need to watch out for. And so I think that understanding that volume and arch count is very important to experience is great, but understanding that time in the game, so to speak, time doing the surgery is just as important to really mastering this craft. I think that for me, one of the incredible blessings that I had early on is I worked at a full arch center at Clear Choice that had been open for roughly 20 years. And at the time, I hated that because I constantly had to do revision cases, and we call them remove and replaces, for cases that had failed implants. I mean, I had multiple failed cases every week, and they weren't necessarily mine. I mean, I had some cases that had failures too, but I mean, the cases every week were these patients that had been in this queue for 20 years. And so there was a patient, 2 patients, 3 patients every week that, maybe this one had their implants placed 10 years ago. Maybe this one had them placed 18 years ago. Maybe this one had it placed 5 years ago. But they're coming back with issues. And, at the time, again, I really hated that. What it taught me, which now I feel is invaluable, is it taught me how to manage a failed case very effectively and with a lot of confidence. But B, it taught me to see things a lot of the times before they happen. And there are ways in which I operate now, where I do things that maybe others don't. And they'll say, well, why are you doing that? And I say, well, it's because I have a feeling of what this case is going to look like in 5 years. And I'm planning for that. Or sometimes there are cases that I won't take on. And, whether that's, I don't know, maybe a severe bimaxillary patient where they only want one jaw. They only want the maxilla, or they only need the maxilla. And because of their bimaxillary protrusion, let's say, you're going to create a situation where you've got a 2 centimeter anterior cantilever trying to pull that upper jaw into occlusion on the lower jaw. And I may say no to that case. And another surgeon might say, well, there's enough bone, I can place them. Why aren't you doing it? And my answer is it's not about the bone. It's about the fact that I know I can place implants in that case, and it may or may not integrate. There may be issues with integration because of the cantilever, but it might integrate. But I know that over the next few years, that case is not going to work. It's not. Either the patient's going to hate it because they're going to have a huge anterior, basically denture like prosthetic. It's going to be a hygiene trap, prosthetic nightmare for food trap, for cleansability. You're going to lead to peri-implantitis, recession, exposed threads, implant failure, not only because you can't clean it, but because you've got a cantilever that's not biomechanically favorable. All of those things. And you know why I pay attention to those things is because I've seen those cases come back at even 2, 3, 4, 5 years later, where it was felt to be a success at the time, but then it's turned into a train wreck, a couple years later. And managing that is incredibly difficult. And so, point being that being able to deal with a lot of cases, even though I haven't been a full arch surgeon for 20 years, I've seen what cases look like and manage them consistently that were done 20 years ago, 18 years ago, 16 years ago, 15 years ago. And you'll see trends and you'll see things that you're like, huh, yeah, I'm going to be careful when I see that patient come in, for a new consult because I've seen what has happened now 3 or 4 times at the 3-year mark with a patient like that. And those are things that you can only develop with time and with seeing how things come back. So I think that's critical. So here's an example of the importance of time. And I'm going to give you an illustration. And I didn't come up with this. This was given to me by a colleague, but there was a captain of a ship. There were 2 captains, okay? One captain sailed his ship many months at once over a single sea, but he was at sea for many, many months. The second captain sailed his ship only a few weeks at a time, but he would sail that ship in many different waters, many different seas, many different months of the year, and in many different types of weather. Now, ultimately, both of those captains sailed their ship the same amount of months. They spent the same amount of time at sea. However, one of those captains is a novice, and one of those captains is an expert. Obviously, the point being that the captain that has seen many different types of weather, many different types of seas, many different times of the year, that one, even though the same amount of time has been spent at sea, that one is the more experienced expert. And I think that that's true in surgery. The best full arch surgeons that I know, they often have very high arch counts because they've been doing it a long time. But what really sets them apart in my mind is the time for which they've been doing the surgery. Because I don't call them when I want to talk about a case to ask them, how many arches have you done? I call them to say, I have this problem. Have you seen this problem? And how did you manage it? And that comes with time. For me personally, I really feel that this time component at this point in my career is what I'm focused on. Obviously, I'm getting better as a surgeon all the time. We can always keep learning. We can always keep getting better. But I think the biggest area for me personally moving forward that I'm trying to focus on is the time component and really understanding what happens to my surgeries with time and how can I operate better on the front end to limit or prevent those problems. I'm not just looking at did the case integrate. It's really what happens with that case over many years. And I challenge those of you, that are operating in this space. And if you're new, I think that just really having this vision of your surgeries to be able to say, I understand there's a surgery and an integration period and then a 4-month integration, but there's a period beyond that where we're still responsible for the case. We still have to manage it. And, what are we seeing in terms of trends that are better for patients or worse for patients in terms of problems that are created down the road? And how, again, over time, what things do we see? What information do we gain that allows us to come back on the front end and say, I'm going to do this case differently to prevent this problem 4 years from now? Or sometimes maybe the answer is maybe this patient isn't a good candidate. I think that I can put implants in, but I know that just putting the implants in is only part of it. They have to be able to have a functioning prosthetic for years to come. So keep those things in mind. Again, true full arch experience is arches cut times time. Okay. All right. That's the pod. And as always, remember, operate in the shadows, adapt relentlessly, and load them all.